Good morning, everyone. Today, I'm here to talk about a fundamental process that often goes unnoticed but plays a crucial role in our overall health, which is the urinary elimination. Have you ever wondered how our bodies rid themselves of waste and maintain the right balance of fluids and chemicals? That's exactly what urinary elimination is all about. In this presentation, we'll delve into the fascinating world of urinary elimination, exploring how our kidneys filter blood to produce urine, how this urine is transported and stored in the bladder, and ultimately, how it is expelled from the body. But more than just understanding the mechanics, we'll also discuss why urinary elimination matters so much for our well-being and what factors can affect this process. So let's proceed to the next slide. Okay, so for the introduction, elimination from the urinary tract is usually taken for granted. Only when a problem arises do most individuals become aware of their urinary habits and any associated symptoms. An individual's urinary habits depends on social culture, personal habits, and physical abilities. In North America, most individuals are accustomed to privacy and clean, even decorative surroundings while they urinate. Okay, so think about going to the bathroom. It is something we all do every day without really thinking about it, right? We just expect everything to work smoothly. But sometimes, if something goes wrong, like if it hurts when we pee or we can't go when we need to, that's when we start paying attention to how our body works when we go to the bathroom. So basically, we don't really think about it until there's a problem. Next. Okay, physiology of urinary elimination. Urinary elimination depends on the effective functioning of the upper urinary tract's kidneys and ureters and the lower urinary tract's urinary bladder, urethra, and pelvic floor. For the kidneys, the paired kidneys are situated on either side of the spinal column behind the peritoneal cavity. The right kidney is slightly lower than the left due to the position of the liver. They are the primary regulators of fluid and acid-base balance in the body, and the functioning units of the kidneys is the nephrons that filter the blood and remove metabolic waste. In the average adult, 1,200 milliliters of blood, or about 21% of the cardiac output, passes through the kidneys every minute. Each kidney contains approximately 1 million nephrons. So when we pee, it's not just a simple thing. It depends on our whole system working well. First, our kidney filters waste and extra water from our blood, making pee. Then tubes called ureters carry that pee from the kidneys to the bladder. The bladder is like a storage tank for pee. When it's full, a muscle called the pelvic floor relaxes and another muscle called the sphincter opens, letting the pee out through a tube called the urethra. So, for everything to go smoothly, all these parts of our urinary system needs to work well together. Next. Okay, so for our kidneys, kidneys are like super important filters in our body, and we've got one on each side of our spine, kind of tucked behind our belly. The right one sits a bit lower because of the liver. They're in charge of keeping the right balance of fluids and acids in our body. Inside them, there are these tiny units called nephrons that do the filtering job. They clean up our blood by removing waste and extra stuff, making urine. So, a lot of blood passes through our kidneys every minute, like about 1,200 milliliters, which is like 21% of the blood of our heart pumps out, and each kidney is packed with around 1 million of these nephrons filter units. Okay, so the next is the ureters. Once the urine is formed in the kidneys, it moves through the collecting ducts into the calyces of the renal pelvis and from there into the ureters. In adults, the ureters are from 25 to 30 centimeter long and about 1.25 centimeter in diameter. The upper end of each ureter is funnel shaped as it enters the kidney. The lower ends of the ureters enter the bladder at the posterior corners of the floor of the bladder. So for this, after our kidneys make urine, it travels through these tiny tubes called ureters. They are about 10 to 12 inches long and half an inch wide in adults. At the top, they are kind of funnel shaped where they connect to the kidneys. Then they carry the urine down to our bladder. So when the ureters meets the bladder, there's this fluff-like thing that acts like a valve, making sure the urine only goes one way, down into the bladder and doesn't flow back into the kidneys, no? So pretty neat, huh? Okay, next is our bladder. The urinary bladder is a hollow muscular organ that serves as a reservoir for urine and as the organs of excretion. When empty, it lies behind the symphysis pubis. In men, the bladder lies in front of the rectum and above the prostate gland. In women, it lies in front of the uterus and vagina. So normal bladder capacity is between 300 and 600 milliliter of urine. So our bladder is like a flexible bag inside our body that holds pee until we are ready to go to the bathroom. It is made of muscle and can stretch to hold more pee as it fills up. When it's time to pee, the muscles in the bladder is squeezed to push the pee out through a tube called the urethra. In guys, the bladder sits in front of the rectum and above the prostate gland, while in girls, it's in front of the uterus and vagina. Normally, it can hold about 10 to 20 ounces of pee, which is like 1 to 2 cups, no? Okay, so for the urethra extends from the bladder to the urinary meatus or opening. The male urethra is approximately 20 cm long and serves as a passageway for semen as well as urine. The meatus is located at the distal end of the penis. In the adult woman, the urethra lies directly behind the symphysis pubis, anterior to the vagina, and its N is between 3 and 4 cm long. The urethra serves only as a passageway for the elimination of urine. The urinary meatus is located between the labia minora in front of the vagina and below the clitoris. So, the urethra is like a tube that carries pee from our bladder to the outside of our body, no? So, in guys, it's about 8 inches long and also carries semen. The pee comes out of a hole at the end of the penis. In girls, the urethra is shorter, about 1.5 inches, and only carries urine. The pee comes out of small opening between the inner lips of the vagina below the clitoris, no? Okay, the next one is the pelvic floor. The vagina, urethra, and rectum pass through the pelvic floor, which consists of sheets of muscles and ligaments that the pelvic floor muscles are under voluntary controls and are important in controlling urination. These muscles can become weakened by pregnancy and childbirth, chronic constipation, a decrease in estrogen or menopause, being overweight, aging, a lack of general fitness. So for the pelvic floor, no, is like a hammock of muscles and ligaments at the bottom of our pelvis that supports our bladder, vagina, and rectum. These muscles are important because they help us control when we pee or continence, no? You can actually control them voluntarily, meaning we can tighten or relax them when we want. Things like pregnancy, childbirth, constipation, menopause, being overweight, getting older, or not being very fit can weaken these muscles. Okay, next one is the urination. Micturition, voiding, and urination all refers to the process of emptying the bladder. Urine collects in the bladder until pressure stimulates special sensory nerve endings in the bladder wall called stretch receptors. This occurs when the adult bladder contains between 250 and 450 milliliter of urine. In children, a considerably smaller volume, 50 to 200 milliliters, stimulates these nerves. So, voluntary control of urination is possible only if the nerves supplying the bladder and urethra, the neutral tracts of the cord and brain, and motor area of the cerebrum are all intact. So, when we pee, no, it's called urination, micturition, or voiding. This happens when our bladder gets full, around 250 to 400 milliliters for adults and 50 to 200 milliliters for kids. So, special nerves in our bladder wall called stretch receptors feel this fullness and send signal to our brain. Being able to hold or release pee depends on our nerves working right, from our bladder and urethra to your spinal cord and brain. So the next one is the factors affecting voiding, psychosocial factors, development factors. So for the factors affecting voiding, numerous factors affect the volume and characteristic of the urine produced and the manner in which it is excreted. For the psychosocial factors, for many individuals, a set of conditions helps stimulates the micturition reflex. These conditions include privacy, normal position, sufficient time, and occasionally running water. Circumstances that do not allow for the client's accustomed conditions may produce anxiety and muscle tensions. So, there are various factors that influence how much urine we produce and how we pee. For the psychosocial factors, things like having privacy, being in a comfortable position, having enough time, and sometimes even hearing running water can help trigger the need to pee. If these conditions are not met, it might cause anxiety and muscle tensions, making it harder to pee comfortably. For the developmental factors, as we grow up, our urinary habits change. For example, babies pee more frequently while adults have more control over when they go. So there are different patterns at different stage of life, and these changes affects how often and how much urine is produced. So next one is changes in urinary elimination throughout the lifespan. The first one is the fetus. The fetal kidney begins to excrete urine between the 11th and 12th week of development. Ability to concentrate urine is minimal because of immature kidneys. Therefore, urine is colorless and odorless and has a specific gravity of 1.008. Because of neuromuscular immaturity, voluntary urinary control is absent, and an infant may urinate as often as 20 times a day. So as babies grow in the womb, their kidneys start making urine around the 11 to 12 week of development because their kidneys are still developing. Their urine is colorless, odorless, and less concentrated. So babies can't control when they pee. So they might go up to 20 times a day. So for the children, is that most renal growth occurs during the first 5 years of life. Variations fetuses, infants, the kidneys efficiency greatly increases after age 2. So as children grow, their kidneys get better at balancing electrolytes and maintaining the body's pH balance. Around 2.5 to 3 years old, kids can feel when their bladder is full, hold their pee, and tell others when they need to go. By age 4 or 5, most kids have full control over their bladder during the day, with daytime control usually happening by age 3. Okay, so the next one is the adults. The kidneys reach maximum size between 35 and 40 years of age. After 50 years, the kidneys begins to diminish in size and function. Most shrinkage occurs in the cortex of the kidneys as individuals' nephrons are lost. So for this one is that as adults age, their kidneys reach their biggest size around 35 to 40 years old, but after 50, they start getting smaller and don't work as well because of the nephrons are lost. This is because some kidney cells shrink and stop working as we get older, diba? So, for the older adults naman is that an estimated 30% of nephrons are lost by age 80. Renal blood flow decreases because of vascular changes and a decrease in cardiac output. The ability to concentrate urine declines. So, for the older adults naman is that about 30% of kidney cells might be lost by age 80. Blood flow to the kidney slows down, making it harder to concentrate urine. Muscles in the bladder weaken, leading to more frequent urination and waking up at night to pee. So weak bladder muscles can also leave some urine behind after peeing, which can cause infections. So some older adults might have trouble controlling their bladder due to mobility issues or nerve problems. Okay, so for the factors affecting voiding, the first one is the fluid and food intake. The healthy body maintains a balance between the amount of fluid ingested and the amount of fluid eliminated. When the amount of fluid intake increases, therefore, the output normally increases also. By contrast, food and fluids high in sodium can cause fluid retentions because water is retained to maintain the normal concentrations of electrolytes. So it means is that our body has a smart systems to regulate how much fluid we need. When we drink more fluids, our body usually produces more urine to get rid of the excess. Conversely, if we don't drink enough, our urine output decreases to conserve water. However, consuming foods or drinks high in sodium can disrupt this balance. Sodium causes our body to retain water to maintain electrolyte balance, which can lead to decreased urine output. Okay, so for the medication, no, it can also affect voiding. Many medications, particularly those affecting the autonomic nervous system, interfere with the normal urination process and may cause retention. Diuretics increase urine formations by preventing the reabsorption of water and electrolytes from the tubules of the kidneys into the bloodstream. Some medications may alter the color of the urine, no? So certain medications, especially those that affect the autonomic nervous system, no, it can interfere with our body's ability to urinate normally, no? For example, no, some medications may block signals that tell our bladder to empty, leading to urine retention. So on the other hand, diuretics are medications that increase urine productions by preventing the reabsorption of water and electrolytes by the kidneys. This increased urine outputs helps removes excess fluid from the body, no? So for the additional, no, some medications may alter the color of urine as a side effect. The example of the medication that can alter the urine, that can alter the color of our urine is the Berocca, no? As you observe, the Berocca can alter the color of urine. When you drink Berocca, no, your urine becomes orange or yellow, no? So that is normal, I think. Okay, so another factors affecting voiding is the muscle tone. Good muscle tone is important to maintain the stretch and contractility of the detrusor muscle so the bladder can fill adequately and empty completely. Clients who requires a retention catheter for a long period of time may have poor bladder muscle tone because continuous drainage of urine prevents the bladder from filling and emptying normally. So for this, for the bladder to work well, its muscle needs to be strong enough to expand when it fills with urine and is squeezed when it empties, no? But if someone uses a catheter for a long time, no, their bladder muscle is pwedeng mag-weaken because of the catheter drains the urine and doesn't let the bladder fill and empty like it should. Okay, so for the pathologic conditions naman, some diseases and pathologies can affect the formation and excretion of urine. Diseases of the kidneys may affect the ability of the nephrons to produce urine. Abnormal amounts of protein or blood cells may be present in the urine, or the kidneys may virtually stop producing urine altogether, a condition known as the renal failure. No, our urinary stone calculus may obstruct a ureter, blocking urine flow from the kidney to the bladder. Hyperplasia, enlargement of the prostate gland, no, a common condition affecting older men, may obstruct the urethra, impairing urination and bladder emptying. So the meaning is that some diseases mess with how our bodies makes or get rid of urine. Kidney problems can affect how much urine we make, no? Stones in our urinary tract can block urine flow, and in older men, an enlarged prostate can block the tube that carries urine out, making it hard to pee. So another factor is affecting voiding, which are the surgical and diagnostic procedures. Some surgical and diagnostic procedures affect the passage of urine and the urine itself. The urethra may swell following a cystoscopy, and surgical procedures on any part of the urinary tract may result in some postoperative bleeding. As a result, the urine may be red or pink tinged for a time. So for the meaning of this one is that certain medical tests or surgeries can affect how we pee and what our urine looks like. For example, after a bladder exam, our pee might look red or pink due to swelling or slight bleeding in the urethra. And the next one is the altered urine production. Although patterns of urination are highly individual, most individuals void about 5 to 6 times a day. Individuals usually void when they first awaken in the morning, before they go to bed, and around mealtime. So, for the altered urine production, so most of the people pee about 5 to 6 times a day, usually when they wake up, before bed, and around meals, But some conditions like polyuria make you produce a lot more pee than usual, sometimes several liters more each day. So, what is polyuria or diuresis? So, polyuria refers to the productions of abnormally large amounts of urine by the kidneys, often several liters more than the client's usual daily output. So, for the polyuria, so this is an abnormal urine production. Okay, so another factors affecting voiding is the polydipsia, oliguria, and anuria, altered or urinary elimination. So for the polydipsia, can follow excessive fluid intake, a condition known as polydipsia, or may be associated with disease such as diabetes mellitus, diabetes insipidus, and chronic nephritis. Polyuria can cause excessive fluid loss, leading to intense thirst, dehydration, and weight loss. Now, so for the polydipsia means excessive thirst, usually due to drinking too much fluid or certain health conditions like diabetes. It can lead to producing too much urine, dehydration, and weight loss. So for the oliguria and anuria, the terms oliguria and anuria are used to describe decreased urinary output. Oliguria is low urine output, usually less than 500 milliliter a day or 30 milliliter an hour for an adult. Although oliguria may occur because of abnormal fluid losses or lack of fluid intake, it often indicates impaired fluid flow to the kidneys or impending renal failure. Anuria refers to a lack of urine production. So, oliguria is when we produce very little urine, often a sign of kidney problems, no? So for the anuria means is we don't produce any urine at all. Then altered urinary elimination, despite normal urine productions, a number of factors or conditions can affect urinary elimination's frequency, nocturia, urgency, and dysuria, often are manifestations of underlying conditions such as UTI. So meaning is that changes in how often we pee or problems like urgency or pain can be signs of health issues like a urinary tract infections. No? So that is the meaning of the altered urinary elimination. So for the another factors of affecting voiding is the frequency and nocturia. Urinary frequency is voiding at frequent intervals that is more than 4 to 6 times per day. An increase in intake of fluid causes some increase in the frequency of voiding. Nocturia is voiding 2 or more times at night. Like frequency is usually expressed in terms of the number of times the individual gets out of bed to void. For example, nocturia times 4. So meaning is that frequency means peeing often, no, more than 4 to 6 times a day. Nocturia is peeing 2 or more times at night, no? So, kapag nag-drink ka ng more liquid or palagi kang umiinom ng tubig, no? Pwede kang makapi palagi, no? The next one is the urgency, no? Is the sudden, strong desire to void. There may or may not be a great deal of urine in the bladder, but the individual feels the need to void immediately. No, so urgency is feeling like we really need to pee right away, even if there's not much urine in our bladder. So that is the urgency. The next one is the dysuria, no? Dysuria is when peeing hurts or is hard. It can be caused by things like urinary infections or narrow urethra. So that is meaning of the dysuria, no? Means voiding that is either painful or difficult. It can accompany a stricture of the urine and injury to the bladder and urethra. So that is the dysuria, no? Kapag nagapi ka, kapag when you try to pee, no, masakit siya or mahirap siyang gawin, no? So the next one is the urinary retention. When emptying of the bladder is impaired, urine accumulates and the bladder becomes overdistended, a condition known as urinary retention. Overdistension of the bladder causes poor contractility of the detrusor muscle, further impairing urination. So means that retention is when we cannot empty our bladder fully. So urine builds up and the bladder gets too full. It can happen because of things like an enlarged prostate, surgery, or certain medication. So ito yung paglaki ng bladder natin, no? It's because of the urine na nag-build sa bladder natin tapos hindi natin siya mapalabas, no? Kaya nagiging full yung bladder natin, nagiging distended, so lumalaki yung bladder natin. So another one is the enuresis. Is involuntary urination in children beyond the age when voluntary bladder control is normally acquired, usually 4 or 5 years of age. Nocturnal enuresis often is irregular in occurrence and affects boys more often than girls. The urinal enuresis may be persistent and pathologic in origin. It affects women and girls more frequently. So means that enuresis is when children pee involuntarily after the age when they are expected to have bladder control. So, usually around 4 or 5 years old, it can happen at night, nocturnal, or during the day or diurnal. So, meaning, no, ito yung mga bata na na nasa right age na pero hindi pa rin nila kayang pigilan yung pag-ihi, no? So, it means na merong problem sa bladder or sa muscle ng bladder nila kasi the usual age of the children na pwede na nilang i-control ang bladder nila is 4 to 5 years of age. So, kapag 4 to 5 years of age na yung children tas hindi pa rin yan nakakontrol yung bladder nila, so pwede na siyang magpa-check up kasi maybe there's a problem in the muscles of the bladder of that children or that particular children. The next one is the urinary incontinence, is any involuntary urine leakage. Older adults have the highest incidence of UI, which puts them at risk for skin breakdown, recurrent UTIs, and fall-related symptoms too of urgency. So, ito naman is when urine leaks out involuntarily. It's more common in older adults and can lead to skin problems, urinary tract infections, and falls. So, mas common to siya sa older adults, no? Kasi napapansin natin or na-observe natin no, sa mga lolo't lola natin, no? Kapag makaihi sila, minsan, bago pa nila masabi na makaihi sila is nakaihi na sila sa panty nila. So, some older adults is need nila mag-diaper kasi hindi nila napipigilan, no? Na hindi nila mapipigilan kahit nararamdaman pa lang nila. So, hindi nila napigilan na nag-leak na pala yung urine. So, yung urine nila. So, that is involuntary. So the next one is the stress urinary incontinence, occurs because of weak pelvic floor muscles or urethral hypermobility causing urine leakage with such activities as laughing, coughing, sneezing, or any body movement that puts pressure on the bladder. So means that it happens when pelvic floor muscles are weak or the urethra moves too much, causing urine leakage when doing things like laughing, coughing, or sneezing. So ito naman is that kapag normal or common ito siya sa mga adults or older adults, no? Kapag nag-laugh sila, nag-cough or nag-sneeze, no? Kapag nasobrahan sila ng ganyan, hindi nila nakokontrol na makapi sila or makaihi sila, no? Hindi nila nakokontrol kasi it's because of the pelvic floor muscles are weak. The next factor is the urgency urinary incontinence. Is also called overactive bladder. It is described as an urgent need to void and the inability to stop urine leakage, which can range from a few drops of soaking of undergarments. So means that it's when you suddenly need to pee and can control leaking, ranging from a few drops to soaking, no? So ito yung parang same din siya sa kanina, no? Na kapag yung suddenly na need mong mag-ihi, pero hindi mo na control na nag-leak siya and na nag-start siya from a few drops tapos biglang nag-soak na lang yung panty mo kasi nag-continuous yung pag-leak ng ihi mo. So the next one is the mixed incontinence, no? Is diagnosed when symptoms of both SUI and UUI are present. The SUI and UUI symptoms do not occur at the same time. Usually, the individual experiences episodes of isolated SUI and isolated UUI. It is very common among older women. So, meaning, having both stress, leakage when pressure is applied like coughing and urgency, sudden need to pee, incontinence, but not at the same time. No, ito yung mix na na-experience mo, pero, ito yung pero ito yung usually na experience ng individual na hindi siya nag-occur at the same time, no? Ito yung kunwari first is na experience mo na kunwari nag-cough ka masyado tapos biglang nagkaroon ng leakage kasi nagkaroon ng pressure sa bladder mo, and then bigla na lang na nagkaroon ka ng urgency to sudden need to pee, no? So kaya hindi siya sabay. So, kaya siya tinawag na mixed incontinence kasi both mo siya na-experience pero hindi sabay. And the next one is the overflow urinary incontinence. This is when the bladder overfills and urine leaks out due to pressure on the urinary sphincter. It occurs in men with an enlarged prostate and clients with a neurologic disorder. So meaning, when the bladder gets too full and leaks due to pressure, common in men with enlarged prostate or neurological issues. No, ito yung common naman ito siya sa mga lalaki kapag meron silang condition na enlarged prostate or neurological disorder, no? Na kapag yung bladder nila is full na so meron there's a possibility na there's a possibility na mag-leak yung ihi due to the pressure in the bladder, and and it's because of the conditions that the man that is experiencing, which are the enlarged prostate or neurologic disorder. And the next one is the transient urinary incontinence, which are the results from factors outside of the urinary tract. No examples: the medication, delirium, infections, constipation. Functional urinary incontinence is a subcategory of transient urinary incontinence. An individual with cognitive impairment may recognize the need to void but unable to communicate the need. So means that temporary leaking caused by factors like medications or infections, no? Functional urinary incontinence is when you know you need to pee but can communicate it, often due to cognitive issues. So meaning naman is to siya, no? Yes, there is a temporary leaking, no, na na-experience ng both gender na dahil sa mga factors kagaya ng medications or infections sa private part, no? And also meaning is that kapag kunwari nafi-feel mo na makaihi ka pero hindi mo magawa, it's because of there are cognitive issues, no? You are experiencing cognitive disorders, no? That is one of the reason. Okay, so this is the average daily urine output by age na. So for the 1 to 2 days old babies, is yung amount dapat ng urine nila is 15 to 60 milliliters. And the next one is the 3 to 10 days, no, 100 to 300. For the 10 days to 2 months old is 250 to 450. 2 months to 1 year is 400 to 500. For 1 to 3 years old, 500 to 600. For the 5 to 8 years old, that is the 600 to 700. For the 8 to 14 years old is 800 to 1,400. Now, for the 14 years to adulthood is 1,500. For the older adulthood, no, dapat yung amount ng urine nila is 1,500 and less, no. So, the next one is the nursing management. The first one is the assessing urine. Normal urine consists of 96% water and 4% solutes. Organic solutes include urea, ammonia, creatinine, and uric acid. Variations in color can occur. Normally, the kidney produces urine at a rate of approximately 60 milliliter per hour, or about 1,500 milliliter per day. No, so it means that urine is mostly water with some other stuff. Kidneys make about 62 milliliter of urine per hour, but this can change based on how much you drink and your health. If urine output drops below 30 milliliter per hour, it might mean a problem. So no, it can varies to the it can varies to the things that you drink, no? Kunwari, naga-drink ka masyado ng water, no? So, pwedeng sumobra yung urine output mo. Pero kapag nag-below siya to 30 milliliter per hour, no? So, you need to have a check-up kasi baka meron ng problem sa bladder mo or sa kidney mo na hindi na masyado nakaka-produce ng urine. So, the next one is the measuring residual urine, no? So, post-void residual urine remaining in the bladder following voiding is normally 50 to 100 milliliter. However, a bladder outlet obstructions or loss of bladder muscle tone may interfere with complete emptying of the bladder during urination. It means that after peeing, a bit of urine usually stays in the bladder, no? Around 50 to 100 milliliter, but sometimes issues like enlarged prostate can stop the bladder from emptying completely, leaving more urine behind. So, no, sa measuring residual, no, after tayo nag-pee, hindi totally na naubos yung urine sa bladder natin, meron pa ring nag-stays, no? That is what you call the residual urine, no? So that is why there are some people that is using the catheterization, no, na para ma-fully empty talaga ang bladder. So, the next nursing management is diagnosing. An example of nursing diagnosis for clients with urinary elimination problems is altered urinary elimination. And to help make it more specific, identify the problem. An example is altered urinary elimination. Another example of nursing diagnosis is urinary incontinence and specifying that type, like functional overflow, reflex, stress, or urge. Other example of nursing diagnosis include potential for incontinence specified type and potential altered urinary elimination. and urinary retention. It means that in nursing, diagnosing urinary problems involves identifying specific issues related to urination. These include problems like urinary retentions, no? So by identifying these specific issues, nurses can tailor their care plans to address the root causes of problems. So for the diagnosing, need mo talagang i-identify yung mga specific issues related to urination para magkaroon ka ng plan kung ano yung next na gagawin mo. So, the next one is the planning. The goals established will vary according to the diagnosis and signs and symptoms. Examples of overall goals for clients with urinary elimination problems may include the following: maintain or restore a normal voiding pattern, regain normal urine output, prevent associated risks such as infections, skin breakdown, fluid and electrolyte imbalance, and lower self-esteem, perform toileting activities independently with or without assistive devices. So, meaning is that once a diagnosis is made, nurses can create care plans to address the identified urinary issues. This involves setting goals to improve the client's urinary functions and prevent complications. So goals might include restoring a normal urination pattern, preventing infections or skin breakdown, promoting independence in toileting, and managing urine leakage. So these plans are personalized to each individual's needs and circumstances, ensuring effective and tailored care. So, the next one is the implementing, no? So, for the implementing, maintaining normal urinary elimination moves interventions to maintain normal urinary eliminations are independent nursing functions. These include promoting adequate fluid intake, maintaining normal voiding habits, and assisting with toileting. So, means that in nursing, implementing interventions to maintain normal urinations involves actions like encouraging enough fluid intake and assisting with toileting. So, pwede to siya na maging independent nursing functions or parang actions ng nursing, independent na yan. So, the next one is the evaluation, no? So, using the overall goals and desired outcome identified in the planning stage, the nurse collects data to evaluate the effectiveness of nursing actions. If the desired outcomes are not achieved, explore the reasons before modifying the care plan. For example, if the outcome remains dry between voiding and at night, is that met? Examples of questions that need to be considered include: what is the client's perceptions of the problem? Does the client understand and comply with the healthcare instruction provided? Is access to toilet facilities a problem? So after implementing in these interventions, nurses check if they are working by comparing outcomes to the goals set earlier. If goals are not met, nurses figure out why before making changes. For example, if someone isn't staying dry between bathroom visits, nurses might check if they understand instructions or have access to the bathroom. So that is what the evaluation. So that's all for my presentation about the urinary elimination.